People have heard the term cataracts, but I'm still finding there's a lot of confusion of understanding what it is. In fact, what I commonly tell my patients, if we live long enough, we will all develop cataracts.
Hello, welcome to Visionary Voices in Optometry. I'm Mark Donison. I'm the CEO of the Ontario Association of Optometrists. I'm joined here by Dr. John Mastronardi. He's a practicing optometrist in Windsor, Ontario.
That's correct.
Thank you very much for joining me today, John.
Thanks for having me back here, Mark.
So today we'd like to talk about cataracts. Cataracts is another eye condition that is quite well known. So let's start at the beginning then. So can you briefly describe exactly what cataracts are?
Yeah, certainly will. Thanks, Mark. People have heard the term cataracts, but I'm still finding there's a lot of confusion of understanding what it is. A big misconception, people think it's some kind of film that grows over top the eyes, and not exactly the way that it works. I've got a little eyeball model here today that I brought with me. And so if you can imagine the very front of the eye, the area we call the iris, the colored portion, and right in the middle where the pupil is, the black area, you could imagine right behind that, if you could look inside the eye, we all have a lens located inside there. And so we're born with that lens, and that's the lens that helps us focus up close when we're reading, looking at our phones, computers, books. We're using this little lens. And so we're born with this lens, and it's born clear and transparent. And as we're aging, this lens slowly starts to lose its transparency. So it starts to fog. So over time, that normal lens becomes foggy. That's what we call a cataract.
What are the main symptoms that patients with cataracts experience? And so you mentioned a little bit about fogginess. So what are the early signs for people?
And so, because this is a lens situated right in our line of sight, as it fogs over time, people start to experience that their vision is starting to blur, that they're having more challenges to see the things that normally are very easy for them to see. Typically, in terms of symptoms, we're going to have difficulty to see. Another big one is night vision trouble. So because this is hazing and we're working under low light conditions, we hear a lot of complaints about night vision being problematic, or sometimes people will start to see halo or glare around lights at night.
So what are the risks? And what are the risk factors when developing cataracts?
Okay, so another good question. I mentioned that we're born with a clear lens. Most of us are born with a clear lens. A lot of people don't know that you can actually be born with a cataract. And so it's, again, really rare, but a child can be born with a cataract and might need intervention at a young age. But that said, it's rare. More commonly, we will see age as the number one risk factor for cataracts. And so we're all aging, and yes, that means we are all at risk for developing cataracts. In fact, what I commonly tell my patients, if we live long enough, we will all develop cataracts. And so it's a natural fogging of that lens. So age is the biggest risk factor, but it's not the only risk factor. So another big one is trauma or injury. So, we'll see sometimes patients who sustained a car accident or an injury, sport injury, a hard blow to the eye. That can trigger the beginning of a cataract formation. Typically, those happen quicker, meaning they might have an injury today, they might develop a cataract in the next 6 to 12 months. Sometimes after an eye surgery, so a patient might have had a surgery to develop to help them with a condition of the retina, which is the back layer of the eye, but that procedure itself started this same process that patients who have had trauma or injury, right. Same thing, they may develop or be expected to develop a cataract in the next 6 to 12 months. Huh. So that's another big one. And another one we always talk to our patients about is UV exposure. So we know the ultraviolet light of the sun does provide benefits. Obviously, the sunlight provides us benefits, but too much of it can be harmful. And we do know that those UV rays can be damaging to the lens that we talked about inside the eye. So wearing proper UV protection and sunglasses is very important over the course of our life to slow the progression of cataract.
What diagnostic tests do you perform then to assess cataract? So particularly with the early stages, right? And so then how do you determine then whether surgery is necessary? Because you hear a lot of people talking about going for cataract surgery nowadays.
Yeah, cataract surgery, very common today. We'll get into that in a little bit down the road here. But during a routine eye exam, it's going to start with just a basic vision, or reading the chart, those letters on the chart, and assessing what kind of vision the patient has. And then further testing to see, is it is there a reduction? If there is a reduction in vision, is it because the prescriptions change? So we'll run through a prescription check to see. And if we can correct their vision to 20/20, we know it's not likely the cataract. That said, if we can't, then we're going to move on to the next step where we're taking a look at the eye with our microscope. So that bright, dreaded light that people sometimes don't enjoy in our office, we will take a look with a light and we will able to actually look directly at that lens to see if it's transparent or if it's losing its transparency.
Which light are you referring to? Because I've been to have my eyes checked just recently, and I've had a couple of different types of lights shown into my eyes. So which one are we talking about?
Yeah, so this is the one where you're putting your chin on a rest, your head, forehead. It's a microscope, so your doctor's looking through almost like a set of binoculars and taking a look directly at that. So we call it's a biomicroscope or a slit lamp.
There you go. Thank you very much for that.
No problem.
So let's move on then. So we talk about identifying that a patient is developing a cataract, right? And so what would the treatments be, or the options for cataract treatment, and then how does the cataract surgery actually go about? So, but I guess before you get to the surgery, is how do you decide when surgery is appropriate?
Yeah, that's a great question, because that's something that is always on the mind of our patients. You hear a lot of eye conditions when you hear about things like glaucoma or retinal detachments, that the sooner you treat it, the better. Cataracts is a little different. We don't typically recommend a surgery as soon as a cataract shows up, because you might have a small cataract and still have pretty close to 20/20 vision. So one of the early drivers in deciding when a patient is going to need surgery, and that is the treatment for cataracts, they need to have that lens that we talked about surgically removed out of the eye and replaced with a plastic lens, an intraocular lens we call, that'll get placed in during the operation to replace the one that was removed. So when do we do that? Really, what I commonly tell my patients is we're going to have that discussion when you start to notice that you're having problems with your day-to-day activities. If you notice your vision's down a little bit, but it's not really affecting what you're doing on a day-to-day basis, we're going to postpone the surgery for a bit, especially if it doesn't look very advanced, very fogged. But if we have somebody who drives for a living, they drive truck and they drive at night, and this early onset cataract is very debilitating for them, that's somebody we might want to recommend surgery at an earlier stage for. But so we'll let the patient kind of drive that discussion early on. Now, we'll get some patients with a very advanced cataract and it's still not bothering them. We'll only let it go so far. For example, to legally drive a car in Ontario, you need 20/50 vision, which is a certain size of letter on our eye chart. If they can't read that size chart and we can't make them see that with glasses, the only way they're going to be able to legally drive is by having cataract surgery. So even if they come in and they're saying they're not having problems, but they're not meeting the ministry requirements for driving, then we have to have that conversation that it's time for treatment.
So we hear a lot of reference to the concept of patient-centered healthcare, right? And so the way that you describe that, it sounds very much like that, right? And so you're tailoring that treatment to the patient and their life and their lifestyle, coupled with your expertise, right, in terms of what that condition is and your view of how best to treat the patients, right?
Yeah, I mean, that's a philosophy we have when we're dealing with patients is, listen, at the end of the day, my job is to educate you. It's to take a look, examine your eyes, find out what's going on, and help educate you so that we can make a decision together. I'm not here to tell someone that they need to do something or not need to do something, but I need them to understand what are the ramifications if they do or don't. So I like to build that collaborative experience for my patients in the exam room, and I think a lot of my colleagues operate in a very similar fashion, that it's working together, helping to answer their questions so they can make a comfortable decision either direction for what's right for them.
So through that consultation period, then once you get to the point where you're starting to sense that surgery is on the horizon, what's the typical wait time then to have somebody in for surgery in the province?
Yeah, wait times is a big one, Mark, here in Ontario. So that really varies. It really varies by surgeon. It varies by region, part of the province. We are really fortunate in Windsor that a patient that I might see today that needs surgery, they'll probably have it done within 3 months. And I acknowledge and know that that is not the norm across the province. There are surgeons, and I know I talked to some of my colleagues in London where there's some wait times that exceed 18 months. I know in northern parts of the province, it could exceed 2 years for cataract surgery. And that's a challenge that we have to address.
So when somebody's gone in for the surgery, how successful is the surgery usually? And then what are the typical outcomes for patients?
Cataract surgery today is extremely successful. The procedure typically takes less than 10 minutes. It's done on an outpatient basis, meaning the patient will go in the morning. They'll typically be home that same day. Minimal downtime in terms of what they're not able to do. There's some restrictions that surgeons will go over with them in terms of, no strenuous bending and lifting, careful in the shower, not getting, water, soap in the eyes, whatnot. Typically wearing some shields to protect their eyes while they're sleeping for the first week, but really minimal downtime. Really, again, circle back, have that discussion with your optometrist and figure out when the right time is for you. But, don't put it off so far that you're afraid to do it, because the vast majority of people who do get this procedure are very happy.
Right. And so that's part of that consultative approach that you would take with the patients, right?
Absolutely.
They're informed, they make the decisions, and they act accordingly, right? And so
absolutely.
Recognizing that there's always a little bit of a risk there for sure, right? Can you talk a little bit about the different types of intraocular lenses? So you mentioned that earlier on, right? And so I've gotten very technical here. And so in a non-technical term, what's that? What are the different types available for cataract surgery?
I could try to simplify it for our viewers today a bit. So first of all, we've got to just answer a basic question about what happens to our eyes when we put a plastic lens in there. Because a lot of people now know that if you have cataract surgery, there are people out there that no longer need to wear glasses after the operation. Okay, so what's happening here? So let's take a patient who needs to wear glasses. You're now going in, you're removing this lens out of their eye, and you're putting another lens in. That lens can be ordered in different prescriptions. So you could order the prescription that patient needs in their eyeglasses and put that in that plastic lens. And so when they come out of this operation, they no longer need glasses to see far away, even if they needed them all their lives. So, this is a really exciting experience for a lot of patients, and an unexpected benefit from the operation, that we're not just getting rid of the fogginess, we're actually getting rid of part of their prescription. In a similar way to, you hear people getting laser eye surgery to get rid of their glasses. This is another procedure available to get rid of your glasses by changing this lens. So when you go in for a consultation, it's typical that the ophthalmologist, which is the eye surgeons in Ontario that will perform this operation, will take some measurements, and that will help them determine what power of lens you need on this implant to go in your eye. That, again, the determining of which lens, which power, there may be a fee associated with that, but you can order the OHIP covered lens in different powers to correct your need for distance vision glasses. So important to understand that you can still correct a lot of your distance vision with an OHIP covered lens. Now, let's go up to this bit of an a la carte menu, because there are options that we were just discussing here. So number one, there are some lenses available. We call them aspherical lenses, and they're just designed a little bit differently. And one of their main features is to help with night vision. So patients who might be doing a lot of night driving or really challenged with night vision might want to consider this type of an upgrade. So same principles, they can be ordered in different powers, so you can still correct your distance glasses, but you can have one that might perform a little bit better at nighttime. Now, keep in mind, and I think I really want to impart this to our viewers, because we get these questions asked a lot in our offices. Sometimes there's a perception out there that the more money someone spends, the better product they're going to get, and sometimes that's true. Not always, though. And so I do hear some patients who are worried sometimes that they're going to make the wrong choice. These are my eyes. I don't want to pick the wrong one. And so circling back here, remember, a lot of times night vision is a problem just because there's a cataract. And just by taking out the cataract, our night vision is going to improve. So don't want people to think that you have to get this upgrade to get better night vision. But listen, these implants are going to be in your eyes for the rest of your lives. They don't need to be replaced, typically, unless there was an injury, which is rare. It can happen, but typically they are in there for life. And so for some people, it is worth it to spend a little extra money to put an implant in that might perform better at night. And, again, you have that conversation with your optometrist. I talk to my patients about that. And very typically, we'll make a recommendation that makes sense for them to that. Now, I want to go up another step in implants. A lot of patients might have heard the word astigmatism. And so astigmatism is another eye focus problem that you can't correct with just a simple basic lens. So we might have a patient who has nearsightedness and astigmatism. The OHIP covered lens would correct the nearsightedness. It won't correct the astigmatism. And people who wear contact lenses will understand this. They know if they have astigmatism, they need special contact lenses. The same is true for this implant that goes into the eye. So you can get a specialized implant. There is a cost to that can correct your astigmatism. So if you have enough of that and it makes sense for you, you might want to make an investment, again, because these lenses are going to be in your eyes for the rest of your life, to correct that astigmatism. Again, super important to have that conversation with your optometrist or the surgeon's office with the consultants that they have in there. Okay, and I guess the last one I want to talk about is what's known as a multifocal lens. So, and before I do that, to understand, I said earlier, you can put this lens in to correct your distance vision, and you can. But what will happen is you'll still need reading glasses after the fact. And for a lot of people, they're happy with that. They're good to go. But there's others who want, if there's an opportunity to wear no glasses whatsoever, then they want to maybe consider this multifocal implant. Okay, so a multifocal implant is like a bifocal, which helps them to see far and close. The one thing I always counsel my patients on, though, is that they work differently than your glasses. And so if we think about a regular pair of bifocals, and this is so important, and I'm sorry I'm taking up a lot of time here, but this is an important topic because we get asked about this all the time. There's so much confusion about this out there. And again, people want to make the right choice. When we wear bifocal glasses, the top part of our lens is usually designed to see far away. The bottom portion of our lens is to help us to read. If we want to see far, we turn and we look up to see far. If we want to see close, we turn our eye to look down. Okay? An implant doesn't work that way. If I move my eye, that implant goes with me wherever I go. So I can't look through different zones. And so I'm oversimplifying it here, but what they do is have that implant so they've got both the far and the reading prescription that you're looking through at the same time. And it's important to understand this because this affects the quality of vision. And so personally, in my practice, I will strongly advise my patients against this type of implant because often those that do, it's quite common, they're unhappy with the results because of the optics of that lens. It is the most expensive type of implant. I think we'll get to the point where we've got some really good implants, and I'm hopeful that technology is going to continue to evolve to get us to that point where we can get an implant that works like the one that we had in our eyes when we were 20 years old. I just haven't seen that yet. And so if I've seen some patients with disappointment after cataract surgery, it's sometimes that have spent that money and either they don't work as well and they still have to wear glasses, or the quality isn't where they come in and say, John, I can see that sign there, but there's all these shadows and glare around that. Like, when's that going to go away? Unfortunately, it's not. It's part of that design. So really important for people to understand what they're selecting and what the side effects are of those lenses. And your optometrists are really well suited to help answer those questions. These are big decisions for people to make and really important ones.
So on top of a patient learning that they've got cataracts and then that they're looking at a surgery, there are also lots of different decision points that they have to make and lots of information that they need to gather to help them make that informed decision.
Absolutely. We're seeing it being an intimidating process for people and for seniors that are more likely to need this. And there's more options. how the procedure gets done. Now, remember, you've got to take something to treat this. You've got to take something out of the eye, and you've got to put something back in. And that means you've got to make cuts. Okay, so there are options today where patients can have lasers used to assist in this process. Now, sometimes patients will come in and they think that, oh, that sounds appealing to me. Someone's just going to take a beam of light and go boom, boom, and fix my cataracts. It's not how that works. So instead of using a knife to make some of the incisions to get into the eye to take that out and put it in, they're using lasers to make the incision before they take something out and put it back in. The point is, there are a lot of options, and it is super important that you really do take the time to understand it, but spend time with your optometrist to try to understand what's right for you.
One of the burning questions that I've heard over time, and I suspect some of our listeners and viewers may be thinking about now, is when they're undergoing the surgery, are they awake? And what do they see?
So a great question, and you're right. We get asked this a lot. There's a lot of fear. You know, patients will tell us, I've never worn contacts all my life because I can't stand the thought of anything coming near my eye. How am I going to get through this operation? So the good news is it's done as an outpatient. So the vast majority of people today are actually not put to sleep completely for this. They're usually given something to relax them, and they're given some local anesthesia, so they're going to block out any potential pain. So typically they're not going to feel anything, and they're not going to see anything happening. So once they realize that, they're usually a little more comfortable going into this, because there are still some apprehensions about going in and having this done. But it's usually a very straightforward, comfortable procedure. Very rare. I've had some patients with high anxiety, nervous about doing this, come back and say, wow, that, really nothing to that.
What are some of the common complications or risks associated with the surgery that patients should be aware of?
So there are some, some more mild ones where people will come out, they'll feel like a gritty sensation, like there's sand or something in there. Sometimes they're feeling that because of the area where there's a little bit of scarring from the incision. The surface might be a little irregular. It doesn't wet as well with a tear on their eye, so they might feel some of that. It might trigger some tearing, so they might notice some watering. I mean, these are definitely annoyances. The good news is they're not sight-threatening, and often with time, those are going away. They're very short-lived. Some of the more serious ones we touched on, again, there can be swelling of the part of your retina, which gives you your central vision. That doesn't always show up on day 1 or 2. Sometimes it shows up several weeks after. So it's common for people after their surgery, about a month after, they're going back to their optometrist. They're likely going to need a change in their eyeglasses. And that's one of the things your optometrist is going to look for, some of that swelling in the macula. I think the important thing to take away here is all of these things are rare and they're all treatable.
So what kind of coverage is available for people when they're facing cataract surgery?
Yeah, so a lot of discussion around this because a lot of these things work together. When we talk about wait times, when we talk about options, there's a lot of confusion about fees out there as well. So again, I want to start to answer that with a point that I made earlier. You can get an OHIP insured cataract surgery basically from beginning to end. It's available for you. There are upgrades at either, each of those steps, whether it's the early measurements, the type of implants, the medication I talk about being injected into the eye. So those are things that you have to discuss with your practitioner. Now, so there's a lot of confusion about this, about privatization and what that means for healthcare and accessibility. Patients can still get a fully OHIP covered cataract surgery in one of these private facilities. Where we're hearing, and I know there's some confusion out there, is what's being perceived as a type of queue jumping. So we're hearing patients in certain parts of the province where if I wait for the OHIP procedure, I've got to wait 18 months. But if I go to this private center, I can get it done in 2 weeks. I want to explain a little bit about what that means. Okay, I talked a little bit earlier about laser eye surgery to get rid of glasses. Not everybody who's seeking to get rid of glasses through a surgery is getting laser done. There are people who are going to have what we call a clear lens extraction. And that means they're in essence having a cataract operation even though they don't have a cataract. Okay? So they're surgically going in, taking out the lens we're born with, and putting in an implant that corrects their distance vision. It's much more stable than some of the laser eye surgeries. And depending on the prescription, it's much more accurate. So it's a nice option for people, and we do talk to people. So there are those surgical centers that are providing these services for people who want to get rid of glasses. Now, let's say you're somebody who has a cataract. You want to wait for your cataract to get done, covered under OHIP. It is unfortunately that long of a wait, 12, 18, 24 months. Yeah. But if you were to go to a refractive surgery center where you say, hey, you know what, I want to get my dependency on glasses reduced and I want to have a surgery, well, that's not covered by OHIP. And you're going in to have, in essence, what is the same operation as a cataract removal, but you're doing it technically for refractive surgery. You're getting the benefit of the cataracts coming out as well. So that's where some of this confusion's happening out there, that it's, oh, if I pay for it, I can get it faster. Yes, technically, because you're going to a center that already exists for technically a different purpose, but will benefit you in getting your refractive surgery.
John, just before we wrap up, is there anything else that you'd like to touch on that we haven't talked about today?
So many eye conditions that lead to blindness are preventable or treatable if caught at the right time. And I can't emphasize that message strong enough, and I think that's what we'll leave our viewers with today.
Thank you so much. Thank you for joining us. 2 key messages. 1 is look after your eyes, and 2, make sure you go for a regular eye exam so that you can work with your optometrist and understand the health of your eyes. And if you have any conditions that are starting to emerge, catching them early is absolutely critical. Thanks again for joining us today. John, thank you so much. It was a fantastic discussion. I really appreciate you coming in.
Very welcome, Mark. It was my pleasure, and happy to help you and your viewers.
Thank you so much. Visionary Voices in Optometry. Stay tuned. Join us again for our next episode.